All right, we will go ahead and get started as folks continue to come in, and please continue to drop your introductions in the chat. We are very excited to see you all and to get a better understanding of who's in the room. But in the interest of time, because we have a lot of wonderful things to share with you in a short amount of time, we will go ahead and dive in. I am going to go ahead and pass it to Dr. Olga Price to take us from here.
Thank you and welcome everyone. On behalf of the Center for Health and Healthcare in Schools, which I direct, and the DC School Behavioral Health Stakeholder Learning Community, it is my great pleasure to welcome you to this webinar to share a bit about our community-driven approach to strengthening the DC School Behavioral Health System and enhancing equity. I am Olga Acosta-Price. I'm an associate professor here at the Milken Institute School of Public Health at GW. And as I said, I also direct the Center for Health and Healthcare in Schools and have been a co-facilitator of the Stakeholder Learning Community. So next slide. Earlier this month, we released a report sharing our collective work to date, which is available online on the center's website. And I think we also included a link in the chat. Today, we're very excited to give you a more personal introduction to this work, showcasing the voices of students, caregivers, and SLC members who've been intimately involved in this work. We're going to start with an overview of how we did the work, and what the SLC is and who's a part of it, and what the process was that we undertook to do the work. We'll also share the experiences and words from students and caregivers and teachers who informed the work. Then we'll share a bit about what we learned, the information that we gathered, the systems models, the policy analysis, and the stakeholder interviews, as well as what we did with that information to develop priorities and some next steps. And finally, we want to think together with you about what's next. We'll share a bit about how this work fits within the broader landscape in DC and the SLC's unique role and impact, and then consider what's next for the SLC, for each of you, and for all of us collectively. So at that point, we'd also love to take questions from the audience. So throughout the webinar, please feel free to use the chat function or the Q&A function to share your questions, and we'll get to as many as we can by the end of today's webinar. And we're also happy to follow up with you if you have questions. So from the beginning, the SLC, the Stakeholder Learning Community, has been driven by this key question. How do we make sure every child in DC schools has early access to the supports and services needed to improve their mental and behavioral health and well-being? So I want to provide some context. The SLC is a multi-sector group of local school behavioral health stakeholders, and that includes parent advocates, education and healthcare practitioners, school administrators, policy researchers, and others from various organizations that you see represented on the slide. It's a passionate, smart, and committed group of people, and I feel so fortunate to have worked alongside them for the last several years. Our key aims as a group have been, first, to develop a shared language around this work and this body of work, integrate diverse perspectives and voices into our thinking, building capacity of a broad range of stakeholder groups in DC, both to understand school behavioral health from a system dynamics perspective, but also including SLC members, students, caregivers, and schools to build understanding of what is needed to better integrate behavioral health supports in schools, of funders and policymakers to think about what investments are needed to ensure the implementation of high quality school mental health interventions, and many more. Identify high impact system and policy levers among the many actions that could be taken, which are more likely to generate high impact, and certainly to enact and advocate together for policy and programmatic changes that we hope to be sustained long-term. This work began in 2017 when the Bainum Family Foundation and our center conducted a landscape analysis to inform the efforts to strengthen school behavioral health and to decrease racial disparities in the utilization of behavioral health and academic performance. This analysis made it clear that there's a lot of work already happening, great work happening in DC, but there was a widely shared desire to regularly convene key stakeholders so that we could better coordinate and strengthen school-based responses to unmet behavioral health needs. So the SLC was launched. And in our first few meetings, we saw some emerging themes around things like provider capacity and the role of school climate, the importance of family engagement, the role of trauma and grief, and how bias stood in the way of things occurring effectively. That really required a better understanding of the system dynamics if we wanted to address them in meaningful ways. So we partnered with Washington University, St. Louis School of Social Work and the Social System Dynamics Lab, who conducted a system dynamics modeling workshop, first with us as the SLC, and then with students, caregivers, and educators. And to supplement what we learned from the systems models, we also conducted an analysis of DC policies and conducted a series of stakeholder interviews, all of which we're going to describe in a little bit more detail later in the webinar. Finally, we worked together as a group to synthesize all of this information and move towards prioritizing and acting on it to begin influencing and improving the system. Throughout all of this work, the SLC's process has been driven by some core values. Our work is rooted in the values of equity and justice, both in terms of our process and who we've engaged, as well as the system levers and policies that we've chosen to focus on. Our work has been community-driven and participatory at every stage of the process. Our work has been coordinated across stakeholders and sectors, and it has been focused at the system level. The crux of our work began with what we call system dynamics modeling, and we engaged it with the SLC, with students, caregivers, and teachers. We use this kind of system mapping to understand dynamic and complex, messy problems. A goal of group model building is to understand and improve mental models for better decisions and actions. So this kind of modeling provides the space to talk about one's own experience at the same time that we can root those personal experiences with an understanding of the underlying structures that are at play. So as we'll talk more later on, it's not so much about the models that result as much as the modeling process itself. It's intended to create shared language, common vision, and build capacity in systems thinking. But instead of continuing to talk about what this process is intended to do, I'm very happy to share with you the perspectives of those who actually participated in this process with us. First, we're going to hear from Deja Burton. She's from DC, a proud graduate from McKinley Tech in 2020, and now a sophomore at Temple University, majoring in supply chain management with a minor in corporate responsibility. Deja co-facilitated and participated in the student model building workshop that we conducted. So now we'll hear from Deja.
I remember the group modeling session was really interesting and kind of eye-opening. I loved working with the kids, even though like I was a kid too, but like working with youth from a different schools, like different backgrounds was really eye-opening because it was like seeing how they experience like their mental health situations at their schools and the type of resources they had access to. It made me really grateful for the resources I had at McKinley, because I know a lot of students basically said like their counselor was either super busy or they never had time, or there just wasn't any, like the resources just weren't adequate enough, or they didn't feel comfortable. And I think the most surprising part, I guess, was just like how involved the youth were and the different ideas that they had about like how they wanted their mental health to be treated. I thought it was pretty like mature of them, because I forgot the age group, but I know they were younger than me. And the fact that they already knew how they wanted to tackle their own mental health and like the type of resources that they wanted was very surprising to me, because when I was their age, I didn't even know like I was severely depressed and had anxiety. I just thought like, this is how it is. But like now it seems like the younger generation, they're aware of these things and they know what they want. and they're able to communicate that. And that was really surprising to me.
So again, a big thank you to Deja, who stays very involved in this work with us, even from Philadelphia, for reminding us of how important it is to ground this system building work in the experiences of young people. And next, we're going to hear from our collaborator and friend, Chioma Uru, who is the mother of 2 boys, a parent advocate, and the founder principal consultant of Chai Born Free. She also helped co-facilitate and participated in our caregiver model building workshop. Now we'll hear from her.
So many caregivers and, parents and guardians were really pouring out their hearts. So the spirit of community was also really alive. That's a key aspect of that I take away. That it was an opportunity where so many people, like I said, who typically I don't get to see in these kinds of spaces, whose ideas and opinions don't get cataloged or notated. And then the facilitation of it felt really interactive. I think, we've also had a lot of time to think through. Prior to that, we were thinking about parent cafes, and the environment really felt as receptive as that kind of, we had people at tables and people really in a huddle mode. And I think the work product that came out of that was reflective of just how comfortable the environment was, how accessible the environment was, and just how wonderful it was. And the people who came from other parts of town who may typically participate in that because it shows up in the north side of the district, came to Southeast to participate. So there was also that, it was really powerful in terms of when I think about the dynamics of who was present and whose voices. We had Black parents, we had brown parents, we had white parents. It was very diverse. Just also knowing and being in community with some of those in attendance. It was also neurodiverse. There were people that were self-advocates, not just parenting, their children, but really having their own mental health journeys that they're on that were present. It was really, really great. And then the opportunity to again, engineer the system and kind of walk through and see what different groups were, how they were thinking and how they were functioning, and the different processes that people were using to think through some of the prompting questions of the system.
So thank you again to both Deja and to Chioma for reminding us of the incredible expertise and leadership and passion that parents and caregivers bring that we need to enlist and tap into as we continue to do this work. So in addition to students and caregivers, we also engaged in model building workshops with teachers. A couple of key insights that we learned from teachers is that their wellness is underappreciated and that crisis response in schools can be a traumatic experience for students, especially when law enforcement gets involved. These kinds of insights both informed and came out of the model building process. And now I'm going to turn it to Vanu, who's going to share more about that.
Thank you so much, Olga, and hello, everyone. My name is Vanu Alakovan. I am founder and principal consultant of Pop Health, a public health consulting practice that partners with multi-sector collaboratives like the SLC to transform health in their communities. We are especially passionate about community-driven policy and systems change. So it has been an honor to be a part of this work, and I'm really excited to be able to share a little bit of it with all of you today. First, I want to build on what we heard from Deja and from Chioma about what the model building process was like. A model at its core is supposed to be the simplest possible explanation of a complex problem. And I know the models that you see on the screen here and in our report don't seem simple by any means, but they do take a set of complex and interrelated factors and really try to map out how they all work together to either improve or worsen the mental health of kids in DC schools. what you see here on the screen are called causal loop diagrams. And the important part here is that these diagrams are a result of the specific set of conversations, of people, of activities that took place during our model building workshops. And you heard some about what this experience was like for Deja and for Shoma, and it really was so powerful and fun to see everyone, huddled around these sheets of paper, writing things down, crossing things out, drawing arrows. And there were so many insights that came out of those discussions and conversations. And like Olga mentioned before, it really is about the modeling process itself more than it is about the models that result. What these diagrams ultimately are a set of hypotheses about how the system behaves. And that means they're meant to be challenged and revised and refined. And if, we know things have changed since we did these, which was, pre-pandemic. And there are lots of other things that are always continuously changing. So these are not meant to be set in stone, but they are meant to help inform how we might think about intervening to improve the system. So I think it can be helpful to deconstruct and reconstruct the overall systems map that we have in our report as a way to illustrate some of the concepts and insights that are captured in these models. So since we were fortunate to do these workshops with the SLC, with students, with caregivers, with teachers, we had the luxury of being able to map both the commonalities in how these different groups experience the system, as well as some of the unique insights that were unique to each of these groups. So across the causal loop diagrams and other models that came out of the workshops from all these different groups, there were two central kind of core features. One was this kind of inner engine of multi-tiered systems of support. So thinking about prevention, identifying need, treatment related to behavioral health. And two, racism as a fundamental cause of school behavioral health outcomes and inequities. Thinking especially about exclusionary discipline when kids get sent out of the classroom or suspended, and how that reduces time spent learning, and how it also leads to worse social and emotional well-being. Around this central core, which again, all stakeholders groups identified, we saw some unique insights emerge from students, from caregivers, from teachers. So we heard from students, and you heard Deja talk about this a little bit, but we heard from students, they often feel that adults don't care, that adults are disciplining them for, quote unquote, attitude instead of understanding the root causes of their behavior. Caregivers talked about their experiences with ineffective communication, with unsuccessful attempts to get their child help at school, with racist responses to their child's behavioral challenges. And then teachers really emphasized their need to be healthy and empowered and well themselves in order to effectively promote student wellness. And putting all of this together, as you see on the screen, you really start to see the value of having all of these perspectives represented in the systems modeling process. And our report dives more deeply into each of these unique insights in ways that really begin to shed light on how we might take action to strengthen the system. Of course, understanding what systems levers to pull on requires a pretty robust understanding of the policy landscape. So we also conducted a review of DC policies most relevant to the behavioral health of children in DC schools. And we focused on current policy activities and gaps that were highlighted by folks we interviewed, which I'll talk about in a moment. We used agency oversight documents and additional resources like legislation summaries and annual reports to conduct this analysis. And as you'll see here, policies were identified in 4 key areas. So first, schools, policies related to the behavioral health expansion, to school discipline, to school climate. Second, family and community, policies related to providing place-based supports, violence prevention, community resiliency. Third, policies around healthcare, especially Medicaid reforms and coverage, and also hospital community benefit. And fourth, other government programs and services, thinking about early childhood mental health supports, crisis services, and services for high need youth. I won't go into detail here, but a number of specific policies and bills within these categories are described in detail in the report in Appendix B. And understanding these policies really helped the SLC in our effort to identify key leverage points in the system that could help promote and sustain change. Understanding the existing policy landscape was one piece of the puzzle, but we also really wanted to understand what policies and regulations key stakeholders in DC thought were most important to improve the school behavioral health system. So I had the pleasure of speaking with 17 different individuals, parent advocates, DC government officials, policy researchers, healthcare leaders, school leaders, and there were a handful of key themes that emerged from these interviews that really fall into the categories of, how do we do this work? What actually should we be doing? And who should be involved? So in terms of how we do this work, interviewees really emphasize the need for building buy-in across all stakeholders. So really thinking about everyone in the school building and outside the school building. And really thinking about, how do we listen more deeply? How do we act on what we hear, especially when it comes to students and caregivers? And also, how do we make it easier to engage with, to access, to use the supports and services that are available? There was also a huge emphasis on explicitly acknowledging, excuse me, explicitly acknowledging the role of racism in the current system and taking concrete action to address disparities, to promote equity, and really thinking about that at the level of policies, of schools, and families. In terms of what needed to happen, folks talked about coordinating and integrating, really thinking both horizontally, so across DC agencies, within schools, between schools and other sectors, including healthcare, and also integrating and coordinating vertically. So what does, what's government telling schools look like? What does within schools, what administrators are telling teachers and staff look like? What schools are telling families, within healthcare, from payers to providers? How do we streamline that kind of integration? Folks also talked a lot about a whole host of implementation factors. So the need to provide sufficient infrastructure and resources, financial incentives, accountability, information and data sharing, more effective governing structures and political processes, and also the flexibility and autonomy that's needed for on-the-ground application and tailoring of approaches. So every school is different, their needs are different. How do we accommodate that? In terms of who does this work, interviews really emphasize the need to first share ownership, so widespread representation, meaningful involvement in decision-making, again, especially of students, of caregivers, of teachers, and then defining ownership, so really clarifying, who owns what and who should be doing what and how do we make that align best with their expertise. And lastly, of course, as no surprise, the need to provide strong leadership, including prioritizing and committing to comprehensive school behavioral health and related efforts. So I know that this was really just a taste of the themes and we couldn't really get into the meat of specific ideas that folks had, but all of that is described in more detail in the report. And we hope that this little taste gives you a sense of the kinds of needs and ideas that informed our work. And now to talk more about how the information we gathered from all of these sources, so the systems modeling, the policy review, the interviews, to talk about how all of that was synthesized and operationalized, I am going to turn it over to Mark.
Thanks, Vanu, and hi, everyone. I'm Mark Lavoda. I'm the Executive Director for the District of Columbia Behavioral Health Association. And I'm so pleased to have had the opportunity to participate in multiple parts of the stakeholder learning process to date, and look forward to continuing collaboration. Really happy to share with you the way that we were able to bring together the policy analysis, the interview insights, and the system dynamics insights. And I think that you'll be interested in hearing about how each of those come together in these 5 categories, where we want to think more comprehensively and have built iteratively to understand how the interplay of policy and people and systems are again, things that either enable success or that detract from success in ultimately making sure that children have access to comprehensive well-being services, and specifically mental well-being services. And you see these 5 key insights that have emerged, that we have to continue to focus our efforts and attention on a multi-tiered system of supports, that we need both tier 1 universal interventions, tier 2 targeted interventions for at-risk group, and tier 3 clinical interventions for the students who need clinical levels of care, that we have to be intentional about student engagement, that we have to be intentional about family engagement, and then also we have to think about the workforce, both the teacher and school leader workforce, and making sure that they have the tools and resources that they need, and the behavioral health services workforce, and making sure that they have the tools and the resources that they need. And to do that, then we return to modeling and did some deeper dives on those kind of cluster specific system models to develop further insight. So we next want to share with you a little bit of what that looks like. Again, this is an example of the kind of systems model that we were able to build that's been put into modeling software now. And we're able to see how changes in one part of the system have ripple effects and cause changes in other parts of the system. Again, there are 2 things to really think about with these types of models. First, the act of modeling drives the conversation. We gain new insight and put new attention on specific parts of the system that we might not have thought about or thought about in the same depth until we asked students and families and caregivers and all of the other stakeholders to say, okay, when we change that thing, what else do you notice? So in the multi-tiered system of supports working group, looking at this kind of systems model and exploring the flow of students through early intervention in tier 2 and more intensive supports in tier 3, we began thinking through things like how to equip teachers to recognize early warning signs and refer students more effectively, and also how best to re-engage students who drop out of services after having poor experiences. I remember an early version of this model where there was an arrow that went nowhere after students did not have a good experience going through the process. And so that was a place for all of us to really examine what does happen to those students and to acknowledge how that fed into an exclusionary discipline process, when instead we could put in place specific tools to stop that from occurring by intervening at the point that otherwise we would have expected a system failure. Second, honing in on those systems models related to specific topics enables us to begin building quantifiable models so that we can put in real data, examine potential impact of policy and practice changes. For example, if we improve referral rates, how much higher can we push the number of healthy students? We also then have to prioritize, right? Based on this kind of discussion, in each of these working groups, we had a long list of ideas about things that we could do. And so we need to be able to think through, how do we then translate that into action? We categorize that in the ways that you see here, based on a level of effort and impact, identifying 4 groups. And then that enabled us to hone in on 11 key high impact priorities across all of the working groups. And so you see here things that we really focused on and turned to as priorities now, that we have to have good services and supports provided, that we have to have good communication with families, that we have to have good data, that we have to have good workforce, and we have to have good payment for the work. And you can see the specific topics that are identified. And you see the ways that each of these provides us with a combination of the approaches that we identified through the modeling work, through the policy analysis, and through the key stakeholder interviews. Just to highlight some of these in a little more detail, we also then are able to do more focused work and look on places where some of these things fit together. So given that there are other coordinating groups that are already focused on issues of data, workforce, and payment, the Stakeholder Learning Collaborative is going to dive more deeply into the first two sets of priorities, and will be focused on services and supports provided, including those Tier 1 and Tier 2 expanded efforts, and on strengthening the school behavioral health coordinator position, as well as communication with families, really thinking through a family liaison role, developing a menu of supports that make sense for each school, and re-envisioning family engagement. And to help operationalize this set of items, we've explored existing activities, stakeholders, gaps, obstacles, and data needs related to each priority. So that gives us some potential next steps. Priority item around expanding Tier 1 and Tier 2 services includes moving forward on some of the action items around, for example, synthesizing data from multiple sources around Tier 2 services and referral rates, determining which specific schools are most struggling with effectively doing the work and filling the school behavioral health coordinator role, polling DC principals to get their insight into current family liaison roles and our desire to incorporate those kinds of roles into their school environments. And then we also have to think through how we make sure that we're talking collaboratively with the community about these different topics. And so turning to the next slide, we spent some time as a stakeholder learning community thinking about what are the key messages that have come out of this work so far that we want to share during this dissemination phase of our work. And in addition to this broad release of the report through the webinar today, we're planning a series of more focused meetings with students, families, funders, policy coordination bodies, and others. And here are some of the key messages that have come out of the work and that we'd like to emphasize. Some are insights directly from students and caregivers, others are insights from group systems modeling, and others point in specific directions that we can take to strengthen the system. For example, students want more trusted adults to share with, safe spaces to speak up in, and the mental and emotional literacy skills to identify and communicate their needs. Most of the caregivers we spoke with don't feel heard or supported, especially in crisis management situations. They want to see more opportunities for two-way communication between families and schools, both on an individual level with respect to their children and on a systems level with respect to policy development and program selection that impacts what's happening in schools. More organizations and coordinating bodies should use, and more funders should invest in, the use of group model building as a tool to test program and policy solutions and examine the impact of different program and policy levers. Participating in the process of modeling drives insight more than reviewing artifacts of the process. It's the modeling, not the model. It's vital that rules are clearly defined and aligned with expertise in terms of what entities, like different DC agencies or CBOs or schools, are responsible for what aspects of which tier of services, as well as which individuals within the school building are responsible for which tier. And if coordinating bodies can help map the overlap of policies and programs and ensure that agencies, CBOs, and other stakeholders align their work before the point where policies and programs are implemented, then schools will experience less fragmentation and overwhelm on the ground. Now I'll turn it back to Olga to talk about where we're moving with that stakeholder learning work.
Thank you so much, Vanu and Mark. Really your involvement and leadership has been wonderful. So as we think about where we go from here as a stakeholder learning community, we want to consider both how we fit into the broader landscape of work that's happening in DC in this space and what our unique role and impact might be. So we want to think about the recommendations and next steps as it relates to supports that, for example, that might support the school behavioral health expansion in general. The community of practice, which is one of the mechanisms for providing technical assistance and implementation support to implement best practices in school mental health across all schools. And other collaboratives who have been very active in this space, like the Behavioral Health Transformation Work Group and the Strengthening Families Coalition, and the areas that they've chosen to really focus on, but also thinking about how the school behavioral health system is interconnected to and influenced by other important child-serving systems, like our child welfare system in DC, our juvenile justice system, pediatric primary care, for example. So in terms of our unique role and impact, we see value in the way that we've been able to first bring together organizations, agencies, individuals, and community members across sectors to strengthen alignment and aims and goals, to take a wide lens so that we are examining the system as a whole, stepping away from topical or organizational silos that are so easy to fall into, systematically gathering input from those most impacted by the system and making sure that happens regularly and authentically, using a system dynamics modeling approach to both quantify and provide narrative context to how different people are experiencing and making their way through the system. Leveraging system models to be decision-making tools to really help us understand and potentially predict what might occur should we invest in certain programmatic or policy action steps. And then prioritizing those action steps using group decision-making processes and operationalizing these priorities so that we can enable concrete action. So rooted in those unique roles that we have as the SLC moves forward, our focus is in three key areas. First, the targeted dissemination of this work, including to families and students, the coordinating council for school behavioral health, and funders. And in conjunction with that, assisting others as they develop specific policy and funding asks to move this work forward. Second, we want to continue our engagement with those impacted most by the system, with the focus on youth in particular, to have them engage in model building and also build their leadership skills for knowing how to talk about their experiences and those of their peers so that it is continual, so their voice is continually heard and informing our system building work. And third, the quantification of relevant system dynamics models so that it informs programmatic and policy decisions to assess the impact. And along with that, moving forward toward further operationalization and implementation of prioritized action steps in collaboration with some of these other coalitions that we've mentioned, advocacy groups such as PAVE, and stakeholders along the way in our communities, and hopefully all of you. So that brings us to what each of you can do. Some key takeaways to begin or to stay engaged in this work include sharing this report and the webinar recordings with your networks. We've created some hashtags that we hope you will use to help bring visibility to the work and to the engagement that we've undertaken. Consider how you can build capacity even in your own community or your organization to co-design action with those that are most impacted by the system. What would that mean for you in the role that you play with the authority that you might have? Consider how you can build capacity in your organizations and communities to engage in system modeling. What would that look like to bring folks together to actually engage in the modeling, to have those conversations and to really unpack where some of the problems and the barriers may actually exist to seeking and utilizing high quality behavioral health services. and then help us move forward on next steps to advance the priorities that we've already identified. So at this point, we want to ask everyone to respond to a quick poll. So we're going to ask you, as we bring the poll up, which aspects of this work most resonate with you? So just take a moment if you can. And I believe that you can check all that apply. So hopefully we'll have those results in a moment, and that will also inform us where we might also continue to reach out to engage you in ways to support you in the role and the ways that you are able to move in your community. So there we go. So we see that it seems that we have sort of a top three three-way tie on those who are interested in co-designing action with those most impacted by the system. So families, caregivers, students, young people, maybe teachers and educators, developing specific policy and funding asks to move this work forward, as well as exploring how to implement prioritized action items in schools. We also see that a number of you are interested in engaging in systems modeling and in working to potentially quantify system models to inform some of our programmatic and policy decisions. So thank you for your responses there. And again, we hope this won't be the only time that that you engage with us around this work. We really do welcome your participation. Before we move to questions, we did want to share a quick reminder of why we're all here and doing this work. It's for students like Deja.
I think it's important for like adults in general to include youth voice, because we are the future, and it's like there's all these expectations on us, but at the end of the day, we're human too. We have lives of our own. We have challenges and traumas that we're also trying to process, and growing up like in the age of like social media and everything being so demanding and like fast paced and grind and do this and do that to be successful. Like eventually we have to talk about like, how does that make us feel? Especially like if you see, like if you have like a single parent that has like 2 jobs and you're not even getting that attention and love from home, but then you go to school and you're trying to be successful, but like you just at some point want to be just a kid. And I feel like a lot of kids are losing out on their childhood because they're already like on grind mode. They're getting jobs at like 14 just to try to support their homes. And that does take a toll on a person's mental health. Like you don't really have that childhood where you're like, oh, my mom will cover it, or my dad will cover it, or my parent got this. Like, it's like, no, I have to choose between this and this, and I have to work hard to be successful. And sometimes that gets overwhelming, and you have like not just like pushing district numbers to say, oh, the CPS did this on testing and this school is doing well. It's more so like students are doing well because they're actually happy. They actually have outlets away from home and different things like that.
So I want to thank again Deja for just her incredible insights. And we hope you're feeling as inspired as we are to ensure that every child in DC schools has access to everything they need to improve their mental well-being and mental health, as well as families and caregivers who really are the primary, supports for all of our young people, and making sure that they too feel supported in their mental well-being. With that, we're happy to take any questions from the audience in the chat function. If there's anything you would like to know more about, anything that we can clarify. Mark and Vanu and I, or any other member of the SLC, who I know a number of us are present, would be happy to answer.
While folks are thinking and putting questions in the chat, I'll just add that we are, as you heard a bit during the presentation, we are thinking very carefully and intentionally about the next phases of this work, both in terms of more targeted sharing, and as we share to specific groups, really working on those, taking what we have thus far and translating that into specific policy and funding asks that are pertinent to, the current bills under consideration, current, funding decisions that are being made in DC and so forth. And we know there are a lot of advocacy groups and other folks that are thinking about this and moving forward on those fronts. So we are really looking forward to collaborating and working together with folks. So to the degree that you are aware of work happening in DC that we might not be connected to, please let us know, please reach out. We are really seeking to broaden the tent as much as possible as we really think about how we move these things forward. Yeah.
Yeah, and I'll add, thank you for that, Vanu. And I'll also add that the SLC has no desire or intention to plan to move all of the action steps and policy agenda forward alone as a group. The idea is that we also have simultaneously been in communication with other coalitions and collaboratives, other advocacy groups, to also better understand where their priorities are and what advocacy agendas they have set with their members, and how we could support them. And so sharing some of the findings and our recommendations, but also trying to see how this might exist already in other spaces, and trying to see how we as a collective could support them. So, and then where there may be no specific organization or coalition that's leading some areas, that certainly we want to be able to continue to promote and advance those ideas. Again, feeling very proud and committed to the process of being very participatory, of being, of really kind of elevating all voices as much as we can throughout the entire process, and not at the end when certain decisions have been made, but really in the cultivation and the synthesis of the work and the ideas is really what has made this, I think, quite unique. And the other thing I'll say is that it has been a big investment of time that all the SLC members have given. And I want to thank all of the members who really, from the beginning, and that means about 3 years ago, if not longer, that we have regularly met and regularly had these discussions from all of our vantage points. And although we, and again, the outcomes and the recommendations actually reflect some learnings and perspectives pre-COVID. And so that is also part of why we are circling, making sure that we're circling back to kind of, to sort of test and make sure that what we have identified and prioritized as a group still resonates, particularly with those who are most impacted by the system. So we have engaged a new set of young people. We've invited all the former set of young people, but many of them have moved on to other phases of life. And but we are re-engaging the families and then identifying new individuals who want to be a part of this conversation. So I wanted to mention that also, that again, the conclusions really aren't firm conclusions. They really are directions in which we are trying to go together to make sure that kind of our collective impact is felt on the system building work that's happening.
And I think that all, thank you so much, Olga. I think that all relates to Joyce's question in the chat. So she mentions we need to think about how the lessons from DC can be translated to other states. It's so important that we as a nation embrace these kinds of system building efforts. And so she asked if we can talk a bit about that. So I can kind of kick us off, and then Mark and Olga, please chime in. But I think to a lot of what Olga just said, and really the way your question is framed too, I really think it is about the process, right? I think that, the policy landscape in different states and localities is unique. The way school systems work, the way Medicaid works, all of that is so different. The policy windows, kind of who the stakeholders are, there are lots of differences. But I think the part that is absolutely translatable is the process, and really the direct engagement of those impacted by the system, the use of systems modeling, which I agree is, I think we all, those of us who've been involved in this have seen the value of it, and definitely agree that it is something we should embrace more broadly in states and localities across the country. I think we're eager to think through how we can best do that, how we can more broadly share what we've learned through this process, and help with some of the pain points in other places that might be interested in doing something similar. So with that, Mark or Olga, anything to add to that?
So I definitely want to reinforce the process is replicable. And I think that part of that is making explicit the systems modeling work looks really hard, but it's not. It is something that people can pick up and learn. It does not require extensive, intensive training. You'll probably have to have a little bit of training to figure it out, but people really can get to the point of doing the modeling very quickly with very little prior knowledge. And so I would want to tell other states that they don't need to be daunted or feel like, well, we could replicate the policy analysis, which is actually really hard, or we could replicate the stakeholder work, which is actually really time consuming. Yeah, you can also replicate the systems modeling. That sort of thinking is just another set of tools that's available. And there's no more barrier and no more burden to doing that than doing any of the other kind of analytic process work that you would need to do to come up with a good plan for systems change.
Absolutely agree. And I would say, the triangulation of kind of what we learned from each of those approaches, I think we feel really good about also. And I don't know that I would say that any one is more important or more worthy of investment, but they each do bring kind of a unique set of kind of learnings to our understanding of what is holding us back from really realizing the success and the kind of impact that DC has been very invested in school behavioral health for a long time. And I'm very proud of being a part of this community that has done that, and that there's so many who have really been committed to this work. But we feel as advocates, as practitioners, as stakeholders, that we don't see the level of impact community by community and school by school that we really want and need to see. And so we need to better understand how where those continued sort of pain points, the challenges are. And so these three kind of approaches and methods, gave us some insights into where we could, potentially be digging in, and where we could kind of, again, direct some of our energy and our efforts. So I hope that, again, the report does detail more, although we did our best to try to not make that an overwhelming document, but we do encourage folks to download it and to follow up with us on questions, or if you'd like to learn more about kind of the journey that we've taken together. So I see that we're almost pretty much at time, and really, I'll start by giving my thanks first to everyone who took the time to be with us and to learn about our work together. And most heartfelt thanks to the stakeholder learning community members, and particularly to Mark for agreeing to co-present and always been so willing to help shape and lead a lot of this work in his role. To Vanu for how much she has done to really keep us all very on task and really just understanding keeping our eyes on the prize. And just also want to thank the Bainham Family Foundation for their support in this work and the financial investment they've made. We do really feel that this is a tool to help us address equity and to help us reach equitable outcomes for many communities. And so we are grateful for how much they've invested in that. So I'll turn maybe to final thoughts to Mark and Vanu.
Well, let me say the thing that Dr. Price doesn't get to say, which is thank you to Olga for your immense leadership in all of this work. It wouldn't have happened without you. And we are all very grateful. I think I speak on behalf of everyone from the stakeholder learning community. And so really so much appreciation to you. And again, to echo, thanks to those who joined us today, both to learn and to those who've been on the journey with us the whole way. Really appreciate your time.
Wonderful. Thank you. Well, I have nothing to add between both of their comments. So thank you all so much for being here.